My name is Daragh Fahey. I'm the Director of Quality, Safety and Risk Management here in Daragh Hospital. We have a very busy hospital. We have over 265,000 outpatient attendances. We have nearly 80,000 attendances in our emergency department. We have approximately 24,000 inpatient admissions and about 47,000 day case admissions every single year. So with all that activity, it's really important that we have a team of people who are devoted to ensuring that the quality of care that the patients receive is of a high standard and always evaluating what we do to try and improve the quality of care even further. And that's fundamentally what we're trying to do within the Quality, Safety and Risk Management division. When people think of quality of care, they often think of that clinical decision that the doctor, the nurse, the allied health professional makes in relation to the diagnosis and the treatment of the patient. And of course, that's really important. That's the kernel of healthcare, but quality is broader than that. And we really embrace that here within Daragh Hospital and the Quality, Safety and Risk Management division. It's really about ensuring that the patients themselves understand their condition, understand their treatment options, and that we provide the right care that's consistent with their needs and their wishes, and that's provided by the right person at the right time in the right environment. We get involved in monitoring healthcare data on a regular basis and survey data, for example, patient survey data. And what we're trying to do there is identify any trends that might suggest that the quality of care isn't quite up to the standard that we'd expect. So, for example, we monitor bloodstream infection rates. So if we were to find that the bloodstream infection rates were to go up above an acceptable level, then immediately we'd be in contact with infection control or the relevant clinical teams to ensure they put in place the different interventions to bring the bloodstream infection levels down to an acceptable rate. And then we will continue to monitor that to ensure that the rates are normal. So that's kind of a background monitoring function that we provide. We also get very much engaged in clinical audit and supporting the clinical teams to get engaged in clinical audit. Every single clinical team in the hospital here needs to be regularly engaging in clinical audit. And what we try to do within the Quality, Safety and Risk Management division is to help them carry out the clinical audits to a high standard, because effectively what they're trying to do is compare their clinical practice to a set of standards, and then if they don't meet the right standard, they put in place corrective measures to ensure they get to the right standard. So it might be a surgical team, for example, who are looking at their complication rates, and if their complication rates were to go beyond what would be an acceptable level compared to an international best practice standard, that they put in place the corrective measures, and that we would work with them if they are struggling, for example, to put in place those corrective measures, to put them in place and ensure that we re-audit to ensure that we're reaching the standards that we would expect. The other thing that we do here within the Quality, Safety and Risk Management division is risk and incident management. So risk management itself is really about being very cognizant and aware of all the different risks in the hospital. Daragh Hospital is no different from any other hospital or indeed any other organisation. We have risks that we need to be aware of, but the most important thing is to identify those risks and to put in place control measures to ensure that an incident doesn't happen that affects patient care. So if, for example, it might be a clinical team who have a piece of medical equipment who sort of come into its end of life or its last legs, the most important thing that they don't just keep soldiering on, that actually they make us aware of those issues and that the risk is identified and escalated to the right team. So the incident management piece is really more of a reactive piece. The reality is that in Daragh Hospital, like any other hospital, we do have incidents, unfortunately, where patients' care is impacted. In that situation, what we do within the Quality, Safety and Risk Management division is either directly ourselves or in partnership with other staff members, we carry out internal investigations to try and understand all the different factors that contributed to that incident. And what we're really trying to do is come up with a set of recommendations that are implemented to make sure that incident doesn't happen again. Because that's always the most important thing. Human error happens, but we can't repeat the same incident. It's just not acceptable, and that's the kind of standard that we're trying to embed here within the hospital. The other area that we're involved in is around linking with our regulator, HIQA, the Health Information and Quality Authority. They have developed a set of national standards for safer, better healthcare for all healthcare providers in Ireland, and they really set the bar in terms of the standards of care, and we welcome that. And we have a sort of a dual function here within the Quality, Safety and Risk Management Division in relation to that. So on one hand, we do a baseline assessment, so we try and assess the hospital against those standards, and where there are gaps, we try and let the clinical teams be aware of those gaps. But it's not enough really just to identify a problem. We have to come up with a solution. And very often people struggle for a number of different reasons to go from an idea in terms of how to improve things to actually implement the solution. And we're very lucky here in Tallaght Hospital, and I think it's reflective of the kind of innovative and progressive nature, because we have a team of people who are very, very good at helping staff go from idea to solution and implement the solution. People who are trained in quality improvement techniques, change management techniques, project management techniques, so that we're not just sitting on a solution, we actually implement it and sustain it and can show the impact. And I think that's reflective of the hospital generally, because we really want to be the best at doing better. We're a learning organisation. We're never happy with, despite whatever quality of care we provide, we never feel that it's good enough. We always want to try and strive to do better. And that's an important culture that we try and embed here within the hospital. So really what I've talked about to now in relation to the Quality, Safety and Risk Management Division has been about patients, but we also support our staff. We have approximately 3,000 staff members here in the hospital, and they really are our best asset. They're our tremendous resource. We have a lot of people with a lot of experience, expertise, who are really committed to driving improved quality and giving our patients the best care possible. And we need to look after them, and we need to nurture them. And within the Quality, Safety and Risk Management Division, we have a team of nurses, doctors, who are devoted to ensuring that our staff are happy and healthy. And that really has a dual function. First, it's the right thing to do. We do value our staff, and we need to show that. But in addition, probably even more importantly, is that we need to have happy, healthy staff, because that will translate into happy, healthy patients. The role they provide is crucially important within the hospital, and they go and they support everybody in the hospital. Everybody who walks in here, whether it's visitors, patients, staff members. They ensure that the environment that we work in is as safe as possible. So our health and safety department are involved in new build or new facilities to ensure they're as safe as possible. They're also involved in ongoing monitoring of potential hazards in the workplace. So for example, it could be clinicians who are working with chemicals, and it's important to ensure that the concentration of those chemicals don't reach toxic levels, so that could be dangerous to both staff, patients, visitors. It's a really important function. They also get involved in a lot of important training, whether it's fire training or chemical training or manual handling training, to ensure they and staff and everybody who comes into the hospital are as safe as possible.